Good morning, everyone. 18 new cases overnight, 13 linked to current exposure sites or identified close contacts. The remaining 5 still under investigation. The more troubling statistic is only 3 of those 18 were in quarantine for their full infectious period. 15 were infectious in the community unknowingly for part of their infectious period. Numbers in hospital have dropped a little to 10. Similarly, numbers in intensive care have dropped to 3, and 1 is requiring ventilation. Our thoughts and our love with the families of the patients in hospital, and particularly in intensive care. Yesterday, 2,754 tests were conducted, so that's up about 10% on the day before's numbers. We'd still like to see people come forward for testing and come forward quickly if you have any symptoms. One of the reasons that people are infectious in the community for a period is that they're infectious before symptoms develop, but we're starting to see people are waiting when they start developing symptoms before getting tested. Please come forward immediately. This reduces your period that you would be infectious in the community. There's been a massive compliance effort across ACT policing, Access Canberra. In the last 24 hours, 723 traffic stops by police, 7 directions to leave the ACT, business compliance checks being conducted by police and Access Canberra. By and large, compliance is good, but there are a few issues that are emerging as consistent themes. Some staff not wearing masks still, or not wearing them properly. Having them under your chin is not wearing a mask. It's useless having it there. If you are at work, you've got to have your mask on and have it on properly. We're also having some cases of staff not checking into their own workplace. This is really critical so that we can contact trace. This is one of the reasons why we have cases that are still under investigation, is that not everyone's checking in even at their place of work. I'd also like to remind Canberrans that when you are click and collecting, the collecting bit of the click and collect does require you to check in at that location when you go to collect your item. The reason we need this is that these are sometimes points where there are casual or sometimes even close contacts. So it's important to check in, please. On the vaccination program, we've now reached 68.6% of the population aged 16 and over with at least a first dose of a vaccine. So we'll cross over the 70% threshold over this weekend, we would anticipate. 45.2% of the population aged 16 plus now have 2 doses of the vaccine. And we're in a close race with Tasmania as to which jurisdiction has the most number of fully vaccinated people. Today we can announce that additional doses of Pfizer that the ACT will receive from the Commonwealth's swap with Singapore will be used over the next 2 weeks to vaccinate all Year 12 students at public, private, Catholic and independent schools as these students prepare to sit their AST in Term 4. Additionally, all teachers, educators and school-based staff who have direct contact with students will also have access to priority vaccination through ACT government clinics. The Deputy Chief Minister, Minister for Education, Yvette Berry, will outline further details of this announcement shortly. So for those who've joined late, 18 new cases overnight. Good news is 13 of them are linked. 5 are still under investigation, but too many, 15, were infectious in the community. We have 10 in hospital and 1 person in intensive, 3 people in intensive care, 1 requiring ventilation. And our thanks again go to the wonderful staff of the intensive care unit at Canberra Hospital for the care that they are providing those people who need it most at the moment. I'll hand over to Dr. Coleman to provide an update on cases and epidemiology. Then Deputy Chief Minister Barry will talk about the education vaccination announcement, and Minister Stephen Smith will also speak, and then we will all be available for questions. Thank you very much.
Good morning, everyone, and thank you very much, Chief Minister. So as the Chief has indicated, since our update yesterday, the ACT has recorded 18 new COVID cases, which brings our total cases for this outbreak to 327. The good news is that 72 of our cases have now recovered, which is another 21 more from yesterday, which leaves 255 active cases. Of those new cases today, I can confirm that 13 of the 18 cases can be linked to known cases or ongoing clusters, and that 7 of these are household contacts. Out of the 18, 3 were in quarantine during their whole infectious period, which leaves us with 15 who were all infectious in the community for at least part of their infectious period. 10 people are in our hospitals, and 3 of these are in ICU, 9 unvaccinated, and 1 person has received 1 dose. I can advise that today we have 1 patient in their 20s requiring ventilation. Of the 10 people in hospital, the youngest continues to be 18 and the oldest is 50. We now have just over 1,100 self-identified close contacts and over 240 active exposure locations. But please, as I remind you every day that I'm here, please continue to keep up to date with the current exposure locations on the ACT COVID-19 website, and if you have been to any of those identified locations, please follow the advice. To provide some analysis on the broader outbreak, as we discuss every day, the majority of cases continues to be in those under 44 years of age, around 84%. So that is not changing very much on a day-by-day basis. And we now have 14 public sites of transmission. Just to remind you, the reason that we highlight these sites separately to our daily exposure locations is these are the sites that we've been able to link multiple cases to, which indicate that there has been some degree of transmission at those sites. These are sites that have some degree of access to the general public, and therefore we want to be able to ensure that we've captured everybody who may have gone to those sites. This also highlights, as the Chief has reminded us, the importance of remembering to use the Check-in CBR app. This not only helps us, but helps us as the contact tracing people, but also makes it easier for you to remember the times and dates that you have visited certain places. You can call it back up and you can check against the website. And again, it's really important, if you've been to any of those locations on the identified dates and times, you must immediately get tested as requested on the site. Today we are adding 2 additional sites to this list. Bidfood, Canberra in Fishweek. This has 4 linked cases, 2 who are ACT residents and they're part of our total outbreak cluster numbers, and 2 cases that are New South Wales residents. We also have KFC in Dixon, which has 3 cases identified to that. And I can report today that we've identified 2 new cases linked to the Ainslie Village. Our multi-agency team, along with our non-government community partners, remain on site at Ainslie Village to provide all support that's needed. So I'd just like to reiterate today that while we are seeing a lot of household and close contacts, we are still seeing transmission in the community. As Dr. Johnston talked to you yesterday, this virus spreads very, very quickly. If you are outside your home, always wear a mask where possible and maintain that social distance. If you do need to quarantine because you have potentially been exposed to COVID-19, please remember this means you must stay at home and you should not have any visitors. Effective quarantine measures are how we will interrupt the chains of transmission, and so far we have actually seen this working. I know that being in lockdown is tough, But please remember that our essential workforce, including our city maintenance and transport workers, our case interviewers and our healthcare professionals, are working day and night to support the community. And please also remember they are likely to be tired as well, often away from their family during these periods of time. So if I could please ask you, be kind if you're actually dealing with these essential workers in the community. And my shout out today is to our operations, planning and logistics teams. These guys keep everything running behind the scenes, and it's an absolute massive job. So they plan for and support thousands of essential workers. They ensure that we're all protected with PPE, planning and delivering our important outreach programs, and sorting through the innumerous logistical challenges associated with this large response, the biggest one that we've ever implemented from a health perspective in the ACT. This team really does anything that needs to be done to ensure that the response and our services can continue to be delivered. So my grateful thanks to them. Thank you, and I'll hand over to Minister Berry, I believe now.
Good afternoon, everyone. Well, as the Chief Minister said, today the ACT Government is opening up priority vaccination for ACT teachers, educators and staff that have direct contact with children in their daily work at schools and early childhood and education care centres, as well for all ACT Year 12 students, AST supervisors and facilitators. We have seen that the Delta strain of the COVID-19 is reaching our schools and early childhood centres, and it's important that we take every possible step to mitigate the risk of this moving forward. Now, there is a lot of information to take in today, so I'll just get straight to it. All ACT Year 12 students will have the opportunity to access priority Pfizer vaccination appointments at the AIS Mass Vaccination Clinic. These first dose appointments will be made available from Monday the 6th till the 17th of September. This will allow Year 12 students to sit critical AST assessments in mid-October in supervised environments as quickly and as safely as possible. This will include those Year 12 students who are sitting their HSC exams as well as their international baccalaureates. I know that Year 12 can be a really stressful time for college students at the best of times, and so providing vaccine protection and a level of certainty around assessments will support our young people who are planning for their future in unsettling and uncertain times. This will also include Year 12 students who are attending ACT public schools, the CIT, non-government schools in Canberra, as well as all AST supervisors and facilitators. For the early childhood education and care sector, the ACT Government recognises that vaccinating our educators and teachers and school staff is an essential step towards ensuring the safe return to normality for Canberrans. We know that teachers and school staff want to protect their students and their colleagues, their families and themselves. This is why from today we have also made the decision to prioritise ACT teachers, educators and staff that have direct contact with children in their daily work at schools and early childhood education and care centres, including out of schools hours care centres for vaccination. Eligible staff will be contacted with more information about how to access priority appointments today. Vaccination of our frontline education staff is an important part of returning to face-to-face education when it's safe to do so. The Education Directorate is working closely with the ACT Health and as well as advice from the Chief Health Officer to consider what a return to face-to-face learning will look like, and will provide more information about that in week 1. I also wanted to inform people that from the 13th of September to the 17th of September, COVID-19 vaccinations for students aged 12 years and older will be delivered to our 4 specialist schools through an in-reach program. This includes Cranley School, Malcara School, Woden School, Black Mountain School, our flexible education students, including those that are studying at Mullion and Cottage, as well as Independent School Galilee, who support a high number of vulnerable students. Private provider Aspen Medical has been engaged to deliver in-reach vaccination to these cohorts. The in-reach program will be available for students aged 12 years and over, and the program will be considered in consultation with parents. And this in-reach program will also be available from late September through to October. So I'm happy to take questions, but I think the Health Minister is going to just make some comments first. So thank you. Thank you.
Thanks very much, Yvette. I've got a couple of updates relating to the vaccination and testing programs for the ACT today. So the first COVID-19 vaccinations have been administered at the AIS Arena COVID-19 mass vaccination clinic this morning. So an absolutely huge thank you to everybody involved in setting up the AIS Arena vaccination hub and to those delivering the vaccination program. It was a really massive effort that I think all Canberrans can be proud of, and it sets us up to continue to expand the ACT government vaccination program as more supply becomes available over the next couple of months. This means we're now on track to reopen the Kerryn COVID-19 testing clinic next week to provide an accessible walk-in testing site. So I know there have been some questions about how the surge centre would be used when the vaccination program moved out of there. So we can confirm, given where we are in terms of cases and the outbreak, that that site will return to being a testing site. And once the testing clinic at Kerryn is operational from next week, testing services at the Western Creek Walk-in Centre will close to allow it to return to its operations as a walk-in centre and community health centre. In relation to the access and sensory vaccination clinic, that will remain at Kerryn for the time being. And people will be advised if they have a current appointment at the access and sensory vaccination clinic when those arrangements change, but we're still working through that. The Kerryn Surge Centre, of course, continues to play such an important role in our overall COVID-19 response. We've seen it stood up as an emergency department if it was needed, become a testing centre, turned into a mass vaccination hub, now going back to being a testing centre and enabling Western Creek to go back to providing those immediate and important community-based health services for the community. And in one more good piece of news for testing, I can now advise that children aged 5 years and older can now access COVID-19 testing at our drive-through testing sites at Epic, Brindabella Park and Canberra. Previously, testing was only available at drive-through for children over 8 years of age, but now children 5 years of age and older can access testing at the drive-through clinics as more staff have been trained in testing techniques for younger children. So again, thank you to all of our staff across our vaccination and testing sites, and thank you to Canberrans for continuing to come forward and get tested and vaccinated. Please continue to do that. This is our pathway out. And I'll hand back to the Chief Minister.
Thank you, Rachel. Happy to take questions. Harry.
Chief Minister, the federal government has reportedly secured 4 million additional Pfizer doses for Australia with a swap deal with the UK. Were you aware this was in the works, and what does it mean for our vaccination rollout? Will we see appointments perhaps move forward?
Sure. Well, I just got a message from the from the Prime Minister whilst I was waiting for this press conference. So that was the first we'd we'd heard of it, other than to say the Prime Minister had indicated that the Australian government was seeking to access more Pfizer supply through arrangements similar to Singapore and Poland. So it's welcome news. The indication was that it would be allocated on a per capita basis, so the ACT would receive somewhere between 1.6 and 1.7% of it. So rough calculation, that's about 65 to 68,000 doses. We're currently doing 45,000 doses a week through our clinics, so it's about a week and a half of additional supply. So that means we can bring a lot forward, depending, of course, on exactly when it arrives. But this is obviously a bigger number than the Singapore number. That was roughly equivalent to one big day. This would appear to be 8 times bigger, so it's probably 8 or 9 days worth of vaccinations that would be able to be brought forward.
Would they go towards those priority groups that have been identified today, for instance?
What we have literally found out in the last 15 minutes, so we'll make a determination based on whether we get it all in a job lot, we're going to get all 65,000 or thereabouts, or whether it's going to come in a series of batches. We'll have to work through the detail of that.
Just to clarify, would people who have already made their booking be able to, would it go to them first or would it go to people making new bookings?
Well, our practice in the past where we've got these sort of Hail Mary new additions, if they come in a big batch, is to be able to bring forward appointments. We just open up new slots. But literally in the last 15 minutes, so just give us a little while to understand when they're actually going to arrive, and are they going to arrive in weekly batches or will it be one big amount?
Heading into National Cabinet discussions this afternoon, what are your priorities there?
Well, to put an end to the madness of media commentary and federal politicians' commentary about 70% being an acceptable number at which you could open up the country. We have the latest Doherty modelling that's updated for thousands and thousands of case numbers, and that points to an uncontrollable outbreak, that it not being safe at 70%. So a clear outcome out of today ought to be to end the 70% debate and turn that to the 80% debate, which, once Australia gets to 80%, is a much safer position than 70%, but going beyond 80% is even safer. And so adherence to the national plan, recognition that the Doherty modelling no longer supports anything crazy happening at 70% would be a really good outcome out of today's National Cabinet meeting.
Chief Minister, with the reinstatement of last year's commercial tenancy agreements yesterday, we've had a few concerns that individuals and families have been left out of these arrangements. Is there anything specific on the way for this cohort?
Individuals and families left out of the
rental relief
for
or assistance?
residential?
Yeah.
Well, it obviously requires the landlord to give a rent reduction to a tenant, and then they get the tax credit for doing so. So you've got to actually have a rent reduction in order to get a tax credit.
Just on that, I know the ACT government, and we've spoken about this before, is undertaking some research into vaccine hesitancy. Is it possible to just get an update on that? And we know it's about roughly 15% based on nationally, people are hesitant. How much of those 15% do you hope to target in hopefully sway their minds towards getting a vaccine?
Well, look, those numbers appear to be coming down. It's less than 15% now. And as I look at the vaccination data, the best indication of someone getting fully vaccinated is, do they come forward for their first dose? And at over 70s in the ACT, we have more than 95%. We have, just looking at this, over 50s at nearly 90%, over 40s in the mid 85% range, and then, because obviously they haven't had access to vaccines yet, a pretty strong take-up though, 30 to 35-year-olds at around 45% first dose, and then 20 to 29-year-olds sitting at about 39% overall. So Once you then add in the bookings that we have, I think in the ACT context, it's an ever-reducing number of people who are hesitant. It's now really falling into the overwhelming majority, 90% plus, who are going to get vaccinated. A small number of people for whom they, for medical reasons, cannot get vaccinated, and then a small proportion for whom, for a variety of reasons, from conspiracy theorists through to people who just don't believe in vaccines, who are just not going to. So there's really not much point focusing a lot of time, energy and resources on people who think this is a Bill Gates world conspiracy. We will narrow down to an even smaller cohort now that are likely to be just a few percent of the population who will need convincing. So I think as each week goes by, the undecided get smaller and more of them are falling on the side of getting vaccinated, which is a great thing.
The construction sector gradually reopening from today. Has there already been a positive case on a construction site in the ACT in the past week or so?
Look, I need to check on that, whether it was in fact an infection that occurred on a construction site or it was an infection that occurred somewhere else. But I'll take that one on notice and we'll have a look at that.
With that in mind, did that influence your thinking about the reopening of the sector? And
any human activity and interaction in an environment like this poses a risk. There's no zero risk outcomes. I think we've discussed this multiple times. Unless everyone stays well apart from everyone else for 2 cycles of infection, which is just never going to happen, you're not going to be able to eliminate all risk. So yes, there is risk associated with any activity. There's risk with essential activity. So what we've been saying is that we're looking at ways that we can minimise risk, and then we all, within an individual setting like construction or retail or outdoor recreation or essential services, supermarkets, things that have to stay open in order for people to be able to buy food and to live. There's risk associated with all of that. We need to look at the totality of that risk across all of those interactions. And so that construction going back means, as I understand today, about 7,000 or 8,000 people went back to work. It was noticeable in terms of traffic on the roads this morning. In a week's time, when the balance of the construction sector returns, you'll see that many people again returning to work. So, of course, each time you ease restrictions, it slightly increases risk. The question is, what are the counterbalancing issues that are reducing risk? And as each day goes by, more people being vaccinated is a counterbalance to the increase of activity.
So if you see a positive case in that group of people who are going back to work from today, could that jeopardise the further reopening of the sector for residential construction, for instance?
Well, look, if there is rampant transmission on construction sites in the next 4 or 5 days, then of course that would necessitate either further public health measures or some form of restriction on activity. But it's a hypothetical at this point. But you've got to respond to facts, of course, and that's why we have had checkpoints before moving to further stages of reopening or restriction easing. I mean, we are going to get more cases. Although we have a reproductive rate for this virus of below 1, and that's a really important objective in terms of eliminating this outbreak, for the rest of time there will be a risk of new cases. The protection against that in the interim are the public health measures, the testing, tracing, isolation and quarantine, and the vaccination program. We've got all 3 working very hard at the moment.
Are you expecting any sort of resolution for plans to vaccinate or otherwise protect under 12s?
Well, I think it's important that there be some further research and a better understanding, particularly of what's happening elsewhere in the world on this question. I understand that there's significant research underway in the United States. Australia has been in the fortunate position that we've sort of been 6 months behind what's been experienced in the Northern Hemisphere. And so we've often had the benefit of being able to see what's gone right and gone wrong in countries well to the north of us in the alternate time of year as well, to get a sense of where the pandemic will go next. So as I understand it, there's quite a lot of international evidence being developed now in relation to the impact, particularly of the Delta strain on children 0 to 12, and interest in terms of vaccination product that may then be available next year for under 12s. So I think it's really important to know more about that. I think everyone should be interested in the latest medical research, the latest developments in terms of combating this pandemic, and a lot of that is coming from the other side of the world at the moment, but it will ultimately be very relevant for Australia.
It's been reported that since the beginning of lockdown, domestic violence has been on the increase. Are you concerned about that as we head into another few weeks of lockdown?
Yes. And there are obviously many aspects of this experience that have significant mental health impacts, have impacts in terms of family relationships, and domestic violence has been an issue in our society before the pandemic, and it remains an issue in our society now. So yes, we are, and we will continue to work closely across government, ACT government, with the Commonwealth government, and with the many outstanding community sector partners who are all working so hard to provide support for individuals who are experiencing domestic and family violence, to provide support for organisations who engage in preventative activities in order to stop it happening in the first place. So this is ongoing work for government, it's ongoing work for the community sector, it's ongoing work for society, and that it is exacerbated in a pandemic highlights one of the many challenges that we are facing at the moment as a society.
And for people who are at home who aren't feeling safe, what do you encourage them to do?
To safely reach out to the many support services that are available. Understand that may not always be easy or straightforward, but there are many services that are available to support you. Please reach out. They can help.
I know the Health Minister addressed this on radio this morning about not looking to shorten the 12-week intervals between AstraZeneca doses. But if you were to get your AstraZeneca dose today, you'd be looking at your second dose in late November, which for some, I guess, some of the 16 to 29-year-olds who've booked their Pfizer vaccines in October and November is pretty much the same waiting period to get fully vaccinated. I mean, does your advice about, getting an AstraZeneca vaccine change now, or do you think people should still be going to get that in their age bracket?
Well, look, I think it's important to get a first dose protection. A first dose protection is better than nothing. The news on this extra batch of Pfizer out of the UK deal that the Prime Minister has announced in the recent minutes may well change how quickly we can get first dose Pfizer into people who are currently booked in to the system. But if I could just ask, I literally found out about this as I'm walking up to this podium, so I'm not going to make it up standing here. I want to speak to our teams about how we could utilise these extra doses. We'll make an announcement on that as soon as we can. But the one thing that is very clear in all of the medical research and evidence in relation to vaccination is that one dose is better than being unvaccinated. And so I would still encourage people to start that vaccination process.
You spoke about your frustration with workers who aren't wearing masks properly and still hearing reports of that. When it comes to compliance checking, how are things looking given the changes that came into effect late yesterday and today as well in the construction sector, also with people just generally out and about now, perhaps in larger groups?
Well, it's only been a few hours on construction activity, so I'll get a report tonight from our compliance teams across WorkSafe, Access Canberra and ACT policing. Generally speaking, it's been pretty positive, but this far into the pandemic, I cannot understand how people don't seem to get the point of the mask. Like, it is just useless wearing it under your chin. It's just useless leaving your nose exposed as well. When your mask's on, it's got to cover your nose and your mouth. That's the whole point of it. Otherwise, you sort of just look like a bit of a dork, really, going around with a mask under your chin. It's not the most fashionable of looks, I would have thought, and it serves no purpose in terms of protecting you or the community. So if you're going to wear a mask, and you need to wear a mask, wear it properly.
And the level of compliance, will that impact whether these restrictions remain as they are or in fact ramped up?
It's got to be a factor, and the Chief of Police has been very clear that police will be focusing on this in a workplace context. It's massively important. We know two things absolutely about this, about transmission in Canberra and everywhere else of the Delta strain in this pandemic. And that it's households and workplaces where a lot of the transmission activity is occurring. But then people who get the virus either at work or somewhere else then infect everyone at home. So if you don't, mask wearing is important because it protects your family as well. Because if you're out of the home and you get infected, you're going to infect everyone who's not vaccinated at home. So wear your mask properly, please.
Unless you guys, I'm up to the Chief Health Officer.
Okay.
Please.
All right, thank you. I'll go off to National Cabinet and Dr. Coleman will come and answer questions. Thank you.
Chief Health Officer, there seems to be no sort of discernible trend with Canberra's case numbers. So we're not seeing them go up every day or go down every day. They're just kind of fluctuating within the teens or early 20s. What does this tell us about the nature of the outbreak? And, you know, for people who might just look at the case numbers as isolated, as that's the only thing that they look at, what kind of reassurance could you provide for them there?
It's an interesting pattern at the moment, isn't it? We certainly saw a very rapid increase over the first couple of days of the outbreak, and then we did see the outbreak peak and a little bit of a decline. But we have reached a plateau at the moment, which is showing us an up and down of case numbers. I don't think that we can put too much into those case numbers at this point in time in the ups and downs per every day. That's a measure of exposure, but it's also a measure of who's getting tested when and when people are in quarantine as part of their testing days. I think what's more important to have a look at is that longer term trend, and we'll be able to talk to you about that every couple of days once we calculate that and start looking at the trending data. Look, I think we still are generally trending in the right direction, but the concern is that it's really slow now. We're only just slightly decreasing down. So I think we all need to keep doing the right things still, but even more so. It's just really important.
On the change in ICU patients, the gentleman that's currently being ventilated, is that the same man who was being ventilated yesterday as well?
Yes.
And all infection locations, I asked the Chief Minister about it. Have we seen a positive case at a construction site in the ACT in the past week or so?
We've got one case which, yes, is linked to a construction site.
How did that influence your thinking about your advice to the government about allowing the construction sector to reopen gradually?
So I don't think one case changes anything at all. I think what is very important to understand is how the response to any cases, and also how the next couple of days of how the construction industry re-stands up business and how they demonstrate their implementation of their COVID safety plans. So if you have a look at the guidelines on the website, they're extremely comprehensive and a requirement around a number of COVID safety elements, including needing to be able to identify every single person who has been on that site, so that if we do need to contact trace, that is accessible at any point of day and night.
Can you confirm the circumstances around that case, where it was?
No, I won't. It's not a public site of exposure or transmission, and we're confident that we have all the information we need to respond to that.
These cases at Ainslie Village, are they residents or workers?
I believe that they're residents.
And are you concerned that we haven't quite stamped it out yet at that site? And is there anything more that we can do to really get a handle on it?
This is a really challenging set of circumstances, and it's a little bit early to be talking about stamping it out. It generally takes at a minimum 14 days from even the first case that we see to be able to determine if there's been even one instant of transmission. So I think we're looking at this for several and potentially many weeks moving forward. As discussed, the start of the outbreak is actually relatively easy. It's the end of the outbreak in the second half of the outbreak where we do start seeing cases and circumstances which are much more complex and much harder. I think this is one of those. But we are working extremely hard, as we've detailed and I think Minister's talked about as well. We have multiple agencies, many community engagement parties, partners involved, and we're all just really on the ground trying to support the situation as much as possible.
Is anyone linked to that site in hospital?
I'm not 100% sure on that.
Give us any update on case investigation as to how the virus got to Canberra in the first place. You're any closer in working that out?
I think my answer to that is the same that it's been previously, is that we have a number of clusters which started this whole thing off, and I don't think we'll ever find out what the actual introduction point into those clusters was.
Can you just provide an update on how many cases where the sources are under investigation at the moment?
Oh, look, I don't have the updated numbers today because, as I said, we do that in a rolling fashion. How about I talk to you about that tomorrow? Okay.
Questions for the Education Minister?
Thank you.
Minister, how will the uptake of these priority appointments impact the return to face-to-face learning? Is one dependent on the other?
No, it depends on the situation at the time and how we're getting a handle on the virus and its spread and the advice of the Chief Health Officer. This will definitely help, though, getting people vaccinated.
So you won't hold people back from face-to-face learning if not enough teachers, for instance, are vaccinated?
Look, I think that's probably a future conversation. At the moment, we're just wanting to get an opportunity out there for as many people to be vaccinated as possible, and understanding that this virus moves differently through our schools and through our early childhood sector. We want to make sure that those workers are vaccinated to protect themselves, but also the students and young people in their care. What happens in the future around where we are as far as easing out of our lockdown requirements at the moment will depend on the future, really.
Just to get some clarity, you said teachers who have direct contact with students will get vaccinations. So is that just those who are going into schools at the moment, or is that just all teachers?
So teachers who are involved in the AST testing, they will definitely be in contact with students. All future education will be face-to-face education at some point. Something for us to all look forward to, but all of those teachers will need to get vaccinated, will have the opportunity to get vaccinated as well.
As part of that 8,000?
Yes, as part of this year.
So to clarify further, so that's potentially any teacher who might be doing face-to-face learning in term 4 if that does indeed return.
Yeah, so to be clear, most teachers will have received at least one dose anyway because they will be eligible within their age bracket or some vulnerability, or because they're working with young people who are vulnerable. So there's already a large number of teachers who are already vaccinated or at least have their first dose. This is giving all other teachers the chance to get at least their first dose in a shorter period of time.
Would you be looking at other grades of students as subsequent priority groups for vaccinations for returning to school?
Well, all of that depends on vaccine availability and, of course, the work that's being done nationally on understanding how the vaccine affects young people under the age of 12.
How many doses are you expecting to need to administer, and how confident are you that we've got enough, given that we do have that Pfizer sort of limit?
Look, again, not completely sure on the number, but quite a few thousand teachers still needing to be vaccinated, because that's across early childhood educators, that's across all our schools, our early childhood settings, out of school hours care settings, non-government, Catholic, independent schools. All of those teachers who haven't received their first dose yet will be given the opportunity to get that through this program.
And sorry, also on the students front, how many doses are you expecting there?
There's around 5,000. Yeah.
And is that all through the Singapore Pfizer swap deal, or is that?
Look, I'm not sure which deal, but definitely there have been more vaccines provided by the federal government, and the vaccine rollout for those students will be part of that.
Sorry, just to clarify as well, for these AST exams, will the vaccines be mandatory for Year 12 and Year 12 students and teachers, or is it still up to them?
No, it's not mandatory at the moment, and we're just allowing people to get that opportunity to get that first dose of the vaccine so that they can feel confident that they are safe to be able to do those AST exams and the International Baccalaureate and the higher school certificate exams in October.
For students who are unable to, for whatever reason, or don't want to get the vaccine, will there be allowances to enable them to still undertake those testings in a remote way?
Look, I think most people want to get vaccinated. I think that's the way we need to be working on, as far as I think most people just want to do the right thing and get vaccinated. That'll be up to them and their health professionals to understand where that goes, and I guess we'd have to get some advice from the Chief Health Officer about what that might look like in the future. But I think we all understand that most people just want to get vaccinated to protect ourselves and our community, and carefully ease our way out of this lockdown.
But for those who perhaps can't or won't, will there be allowances made to enable them to still participate in testing?
I think these are decisions that we'd have to look at as they come up in an individual circumstance, and there might be reasons for that, and we'd just take advice from the Chief Health Officer on those circumstances.
In terms of actually getting the students vaccinated, will we be looking at putting on special trips or buses to help people actually get out and get the jab?
It's free public transport on the light rail and buses. You just need to show that you've got an appointment at the AIS for your COVID vaccine. If there were special circumstances, I'm sure we could arrange some special transport in those circumstances.
But the onus to sort of do it in your own time for those Year 12s?
Yeah. And generally Year 12 students are pretty able to get themselves around. Yeah. Can I just make a comment here just on the question that was asked around domestic and family violence? I just wanted to add a little bit more information to that, just to make sure that people understand that if they are in an unsafe environment at their home, that they can leave. They can get support on how to leave safely from the Domestic Violence Crisis Service. That is a 24-hour, 7-day-a-week service, and the phone number to call there is 6280 0900. If it is just unsafe for you at any point in time and you must leave, then you can go to a police station and get support there, or call 000. If you just need support, then calling the Domestic Violence Crisis Service as well can provide you with support or link you up with other services that you might need. But I think it's very important for everybody to understand that this lockdown does not apply to people whose safety is being put at risk at home.
Some questions for the Health Minister, if we can.
Oh, yep.
Minister, some priority vaccination groups identified today. Is the government looking at other priority groups of workers returning to the workplace, for instance in the construction sector, or those already perhaps working in essential retail at this point?
No, not specifically.
At the Big Foods exposure site, we've got 7 days in a row where someone who was positive was there. How did this happen, and are you expecting more cases to arise from that?
Well, I think we've talked a lot about the fact that with the Delta strain in particular, there can be circumstances where people don't know that they've been exposed. They're not necessarily symptomatic, or they might be symptomatic, but they might think that they've got a cold or whatever, but they don't think that they have possibly been exposed to the virus. So they're infectious in the community, unknowingly going about their essential work and because of the fact that this virus spreads so quickly and people can become infectious so quickly after their first exposure. So that period of time is often shorter than it has been in the past. That's why we tend to see these exposures in the community of people who are infectious without knowing it.
And so were they an essential worker, and was it the same person each day, or was it sort of a bit of rolling transmission almost?
Look, I can't answer that second question, and it is possible that that is why it's an extended period of time. But yes, they work in a food distribution. Bid Foods is a food distribution centre that is part of the essential workforce.
Minister, you've expressed your concern about the low numbers of testing, but you said this morning while speaking on Breakfast Radio that you don't want people who are asymptomatic and who haven't been to an exposure site to go and get tested. So how are we going to drive up those testing rates if we can?
Well, I think there are probably a lot of people out there in the community who are symptomatic who are not going and getting tested. So the real message is, if you have the mildest of symptoms, cold and flu type symptoms, symptoms of COVID-19, they are, basically the same types of symptoms. Please go and get tested. There are guidelines around who is actually eligible for testing, and so if people turn up to the testing centres and they're not symptomatic and they haven't been at a close or casual contact exposure location, they won't actually be tested. So I don't want to send people there and then have them turned away because they don't meet the criteria for testing. And it is just one of those reality things of we can't actually have the entire community that's asymptomatic being tested constantly. We just don't have the resources, and it's not actually helpful surveillance. And yes, it does mean, sometimes people are asymptomatic but still have transmission potential of the virus. But it is one of those public health risks that is balanced, and we operate according to the guidelines that are set at a national level. Thanks, Kerryn.
Thanks, Kerryn.